Ballet School of Nursing and Midwifery. I'm a clinical midwifery instructor. I'm called Abute Victorina. These are our students. They are student nurses and student midwives in year 2 and then year 1. I am going to demonstrate second stage of labor, that is delivery. So I've prepared some of the things that we are going to use. So we have our sterile trolley here that I'm going to go through briefly. On the bottom shelf, we have a small draw sheet and a small Macintosh that we shall put on the bottom of the mother, that is to protect the bed from getting soiled. We have the nurse's apron, which is for your protection as a nurse. We have a receiver for used swabs to receive used cotton, used gloves. We also have a fetoscope. Of course, before you conduct the delivery, you need to confirm that the baby is alive. So you palpate and listen to the fetal heart. We also have another receiver containing toilet paper. Usually during the delivery, mothers usually have to pass stool most times. So before you conduct, of course, if you pass a stool, you have to clean using the toilet paper. Then we also have KY jelly because you have to empty the bladder. So you use it for lubricating what? The catheter. We also have another receiver containing syringes and then oxytocin, because during the third stage of labor, we have to give what? Oxytocin. And then we also have antiseptic solution, Savlon, which we shall use for vulva swabbing. We also have disposable gloves or examination gloves for mother's preparation. And then we have sterile gloves. So you can have them on the bottom shelf. If you open them, you have to put them on the top shelf. So this is our top shelf, the sterile part of the trolley. So when you open it, make sure you open away. You don't open it once. So you open it like this. So on the top shelf, we have 3 bowls. We have a bowl of cotton swabs that we shall use for vulva swabbing. We have a second bowl containing gauze swabs. We can use it during stitching. In case of that, you can even make a pad using the swabs. And then we have the third one containing antiseptic solution that you use for vulva swabbing. We also have sterile sheets for receiving the baby, and then also sterile towels that you can use in case you don't prefer using a drape. But we also have a drape in the receiver to provide that sterile environment. We also have a penguin sucker for suctioning, removing extra excretion from the neonates. And then we have a catheter. If you have not opened, then you keep it on the bottom shelf. When you open it, you keep it on the top shelf. Of course, we shall have to empty the bladder, so that's why you have it here. And then we also have the perennial pad, okay? And then we also have a receiver containing some of the instruments that we shall use during the delivery. Here we have one of the instruments. This is an episiotomy scissor. This is used to enlarge the perineal outlets if it is tight, okay? So that you can fasten the delivery for the baby. We have a pair of artery forceps that we shall use for clamping the cord. We have a cord scissor for cutting the cord. We also have a needle holder. In case you've made an episiotomy, you have to stitch it. And then we have a dissecting forceps. And then we also have a sterile hand towel. Of course, it's a sterile procedure. You have to use sterile hand washing. Then you can use this for cleaning, for drying your hands. I think that is all we have. On the bedside, we have our bucket to receive any wastes. We shall also have a screen, which we already have here. We shall also have gumboots, which I already have on, and then also the hand washing apparatus. So I think we are going to start with the procedure. Good afternoon, Mama. I'm Vicky. Thank you so much. You've been here for some time and you've been laboring. So it's time for me to check on the way of the baby if it is time for you to deliver. If it's time for you to deliver, I'm going to help you to deliver the baby. I beg for your situation. No one is going to be there to see you. I'll only ask for an assistant to come and help. So you cooperate with me. Let me prepare very fast, and then I come and first check on the baby, then I'll check on the weight. If you're able to deliver, then I can help you.
It's
Okay, thank you so much. Let me prepare. What you're going to do is you have to make sure that you do your hand washing after reassuring the mother. If you gain her consent, you do your hand washing. And then of course remember, what we are missing here is the goggles. You're supposed to have goggles to prevent you from splashes. So you can have your mask on, your gumboots on. You also have your apron on. So Mama, come. Help me and first remove the cloth, lie on your back, and then I'll first check on how the baby is. So since we have the other, but if that is the only one you have on the bed, it means you have to put another Macintosh and then a small draw sheet. So Mama, help me, and then you try and raise your buttocks up. Okay. So try to cover this side. So I want to first check on how the baby is. Okay, Mama, the baby is breathing well. So let me wash my hands. You can turn on the side a little bit. When I come back, then you can turn. So what you do, make sure you remove your gloves and then you open your trolley. Before you do the surgical hand washing, replace everything that you need on the top shelf. Now I can do surgical hand. So you make sure you wet your hands up to the level of the wrist. Mama, open your mouth and you breathe. Open your mouth and you breathe. And then you can dry your hands. Open your mouth, you breathe. So Mama, turn on your back. Turn. Turn on your back. Okay, open up. Extend a little bit. Well, it's behind a little bit. Okay.
I push.
No, don't push. Open your mouth and you breathe. Open your mouth and you breathe. So you're going to prepare 5 swabs. So before you swab, you have to inspect, okay? So on inspection, you inspect what you're seeing exactly. Yeah? Okay, so on vulval inspection, if there is clear light or seeing draining, you report. If it is meconium stained, you report. If you're seeing the fetal head, okay, you also report. The fetal head is seen at the vulva, okay? Then you swab. Starting from there, farthest, you swab, one swab, you discard, drop the other swab, swab the other side, and you. Then you go, swab the left minora, swab the right minora. In the last swab, you're going to clean the vestibule. Are we there? Yes. Then you shall need to empty the bladder. So you can use a smaller drape. If it is small, then you can go for the bigger drape. Okay? You can use this or you can use the towels. So, Mama, you can lift, throw without touching the other side. You can get another one, and then you cover the top like this. All together. Yes. Then we can try to empty the bladder. So, KY jelly, you can use it if analysis can be just working with it. So someone can help me with a KY jelly. The lubricant is down. Put it here. Enough. So use the gauze, then you try and lubricate, okay? Like this. Make sure the other part of the catheter is in the receiver. And then, Mama, I'm going to push this small tube inside because I want to try and remove some of the urine. Yeah? So it's going to be a little bit painful, but you bear with me. So you open the vestibule, okay? Locate where the urethra is, orifice, and then you try and push. Sorry, Mama. Sorry. So when you reach there, you do what? You empty the bladder. Of course, the urine comes out. Usually in second stage, you find that the fetal head has blocked. Yeah? So what we do, if the bladder is full, you try and push your 2 fingers from down. Okay? So that these 2 fingers try to push the fetal head downwards so that you get some space. Okay? And then you push the catheter in between your fingers to go through. So since you've emptied, you may need to use this later on in that stage again, so the urine can go down and then you keep your catheter on top. Put it in a receiver. So, Mama, I want now to check if the way of the baby is open. Okay? So, I'm going to push my 2 fingers to check if the baby is open. Eh? So, you push. On vagina examination, the vagina is warm and moist. The cervix is not felt. Therefore, the hose is fully dilated. The presenting part is vertex in low cavity. The membranes are ruptured. The position is right occipital anterior. So, Mama, if the pain comes, you try and do what? So usually, you have to make sure you put the perineal pad down, okay? So that in case she passes the fecal matter, this tries to push it down so that the baby's face does not come in contact with the feces. So Mama, push, push, push. Now what you do is, you have to make sure that the 2 fingers you're going to put at the occiput. Are we together? Yes. Because we are aiming at flexing the head more, okay? Yes. To flex the head, as you're pushing, this comes. When you see the parietal eminence is out, you grab, okay? Yes. When you grab, you aid extension to deliver the face. Meaning the face, that is the sinciput, face and mentum will sweep the perineum. At this point, if you see that the mucus are a lot, okay? That is when you pick the penguin